December 2025 was one of the biggest surgical months my partner had ever had in his entire career. 91 surgeries. 91! If you're not an orthopedic surgeon, it's hard to appreciate what that actually means physically and mentally. But that's just not busy. That's arriving before sunrise, operating all day, clinics stacked around the surgery, endless charting, complications always in the back of your mind, and the pressure of knowing every patient expects you to be perfect every single time. Joint replacement isn't factory work. These are real people, real risk, real responsibility. And despite all that, he kept pushing because surgeons are taught this one simple equation: work harder, do more cases, create more value, get rewarded. That's what most of us believe. That month generated almost $1.2 million in charges. So naturally, a couple of months later, he expected to see a meaningful bump in collections and compensation once those cases cleared through the normal billing cycle. But guess what? It never came. Instead, the numbers were basically flat. So he did what a lot of surgeons eventually do. He started to investigate. He emailed the billing company asking about denials, asking about payer mix, delays, accounts receivable. He was just trying to understand where the disconnect was between the amount of work performed and the financial outcome on the other side, right? It makes sense. More work, more financial outcome, right? Should make absolute sense. And if anything, it should be more work, higher financial outcome, because the fixed overhead has already been covered. And so anything on top of that is just gravy, right? Well, eventually, our practice administrator put together a waterfall report tracing where the money actually went. And that report was eye-opening. Not because there was some sort of massive conspiracy against him, not because anyone necessarily did anything wrong, but because it exposed how many layers exist between surgeon effort and surgeon compensation in the modern medical practice. Contractual adjustments, payer compression, collection inefficiencies, administrative leakage, overhead allocation, timing lag, insurance dynamics, fragmented incentives. The more he looked at it, the clearer the realization became. Volume alone is not leverage. That's the trap a lot of surgeons are living right now. We're told to solve every problem with more productivity. Do another case, right? Add another clinic. Work another Friday. Increase your volume. Take some call. But eventually, you hit a moment where you realize you can produce at an elite level and you can physically exhaust yourself. You can create enormous amounts of economic value and still not meaningfully control the economics. That's a dangerous place for physicians to live long term, because once effort and reward become disconnected, burnout is what accelerates. The lesson here isn't surgeons deserve sympathy, and it's definitely not everyone is corrupt. The lesson is that physicians need to understand the business side of healthcare far better than we're trained to do. Because if you don't understand the system, you can spend years believing that more work automatically creates more opportunity. Sometimes it just creates more exposure. That's one of the reasons I've become so passionate about different practice models, alignment, ownership, transparency. Not because surgeons need to make infinite amounts of money. We're never going to do that. We're surgeons. But because there has to be a better connection between the value we create and the people we're actually creating it for. My partner did 91 surgeries that month. And in the end, the biggest thing he got back wasn't a bonus check. It was a waterfall report explaining where the money went. If you're a surgeon who knows the system isn't working anymore, you're not crazy. You just need a different model. And that's what we talk about here at NAOCA.